Hi, this is Dr. Ayyappan Nair. I'm a shoulder and a sports injury specialist at Manipal Hospital, Whitefield. So, this chat is basically to tell you about some common sports injuries which is normally found in athletes. So, it mainly depends upon the kind of athletic, thing you choose. For example, a footballer would be having a different one, a basketballer a different kind of injury. So, a runner would be having different types of injuries. So, I thought the most common is definitely the knee and then the thigh and the ankle areas, because almost everybody has to move the lower limbs a lot. So when you look at a footballer, what is a common injury? Most common footballing injuries are basically the muscle injuries in the thigh area, hamstrings, the quadriceps, the adductors. These are the injuries which is found. So how do you treat it? Definitely, once you have an injury, we need to evaluate it. Especially if you're a professional athlete, we need to know what is the grade of injury. Is it a complete injury or an incomplete injury? Incomplete or a partial injury can be definitely treated with rest, immobilization, proper rehabilitation, and then you go back to normalcy. But if it is a significant muscle rupture, then you need to undergo surgery. So main thing is evaluation and finding out the nature of injury and then treating it accordingly. Then another important thing is, which is noticeable, is that even if you have a muscle injury, there is a high chance of recurrence. That means if I have a muscle hamstring injury and if I don't carefully go back to sport, then within the next 6 months, if I play again without conditioning myself, I have a very high chance of having a re-injury to that particular muscle. That is a important thing. The other injuries are, we have ankle sprains. There are ligaments around the ankle. Ankle is a very important structure because it takes all the load, and the structures around it are very sensitive, because when you twist, turn, you can have a muscle rupture. Or I mean a ligament rupture. So these ligaments, once you have an injury, you have to immobilize it. Absolutely immobilize it for 3 weeks, because soft tissue healing time is 3 weeks. You take care of it for 3 weeks, it can really heal up. The problem is when you don't take care, when it doesn't see. The other way to put it is, suppose this is a ligament. Ligament is like a band of tissue. So there is a rupture or a tear in this ligament. So what happens is, I have a tear, so that there's a tear like this, and I need to maintain this position exactly like this, either putting a plaster or a brace. If you don't, what happens? I keep moving. For example, I have a ligament injury. I keep moving like this, so the ligament comes away. It doesn't heal. When it doesn't heal, you require surgery. So immobilization is the key to recover on a ligament injury, especially around the ankle or the knee. In the knee, again, footballers can have the ACL injury, which is a main structure, which is a stabilizer inside. If ACL is gone, definitely requires surgery. Certain other structures like the MCL, which is a side ligament, the LCL, the opposite side ligament, all these ligaments, if they are partial tears, you can manage without surgery, but otherwise you definitely require them. In an athlete, treatment is very different from a regular person, a non-athletic person. An athlete doesn't have time. He doesn't have a lot of time to just recover and recuperate. So we need to operate on him as soon as possible, put him back to sport as soon as possible. So a prompt intervention in an athlete, with either surgical or non-surgical, whichever has to be done immediately. And otherwise, you will definitely use your athletic time and even your athletic career. So that's the difference between an athletic injury and a non-athletic injury. There are other injuries also. You can have concussions in the brain. You can have soft tissue injuries. You can, for example, if I'm a overhead athlete, if I'm a bowler, I can have certain injuries called as slap injuries in the shoulder. I can have rotator cuff tears. So it is basically according to the profession you choose. So, but the main thing is, athletes require more attention and a prompt surgical intervention if required. Thank you.